Welcome back, guys. It's Dr. Mike, and today we're going to be talking about how you can use a percussion gun or a massage gun to easily address and target any stiffness or tightness or maybe even pain that you're dealing with in the shoulder joint. Now, we've often seen these percussion guns in sports stores and many different retail stores that you can purchase. And many people will just purchase this specific device and they'll place an attachment on there and they'll just start kind of using it all the way around their shoulder, not really being specific about where they're placing the attachment. And in this video, I wanted to just clarify the specifics on how to properly use a device like this and how you can most benefit, especially on your days of recovery or if you're dealing with a specific injury. Now, notice here that the massage gun that I'm using here has a plastic attachment, and this is going to be great, especially if you're trying to reach deeper levels and you're not so sensitive to the pressure that you're going to be receiving from the massage gun. So the plastic tip is going to be very important, but also the surface area. It's a bit smaller here, and so if you have something that's larger, although it's going to feel pretty good on the shoulder because you're just massaging the whole area, you're not really being specific on the muscles that you're trying to target here. Now, when we're dealing with shoulder pain or stiffness in the shoulder, if you really want to make a difference here, you really want to address the specific areas of the shoulder. And we commonly see, especially in the rehab world, when we're dealing with shoulder injuries, maybe that's rotator cuff injuries, labral tears, maybe that's a shoulder surgery that you've recently had. A lot of the muscles that typically will get tight, and this is in general, is in the pecs, upper trap, as well as underneath. And we can deal with some of the lats and the subscap. That's one of the other rotator cuff muscles that we often see gets tight, because a lot of people will be in this close packed position here, or they're used to keeping their arm down at their side, maybe if they're typing on a computer for long periods. But anyways, let's show you how to use this massage gun, and we're going to first focus on the chest area, which is going to be the pecs. Okay, so we're going to go ahead and turn on this tool here, and I have it at a very low setting, and it's going pretty slow here, and I'm going to go gentle. So the harder I press, obviously the deeper that I'm going to go using this probe here, so within the muscle belly. And so if you're just starting off with this, or maybe you've never used a tool like this before, you might want to just go gently, superficially over the skin, and then as you tolerate this treatment more, you can obviously go deeper and deeper by the angle of how you're using the gun. So if I use the gun just straight at my chest here and I go straight down, I'm obviously going to have a deeper level that I'm reaching. But if I just kind of go at an angle, I might attack more of the superficial layer of the muscle there. Hopefully that makes sense, and that's not too confusing for you guys. But so we're focusing on the chest area first. We can feel, if you just put your hand over your collarbone, right? That's your collarbone. We don't want to place this right over the collarbone because that's not going to feel good. But we're going to go just beneath the collarbone here for the chest area. And specifically, we're addressing the pecs, the chest muscles. We have the Pec Major, and then we have a smaller one, which is a Pec Minor, and that's at a deeper level. And so you can reach that just underneath by kind of taking this probe there, the tip of the gun there, and just working along any sensitive areas. Now, when you're doing this, if you can get that arm in a nice extended position, notice I'm supported on the box, so this is going to be extremely helpful. If you're just holding your arm up and doing this, obviously it might feel good, but you're actively holding on. All those muscles are still working, so you want that shoulder to just relax. And I have it supported here on a box, but you can have it supported on like a couch. And you're simply working through the chest, so all through the front here, which is close to the sternum, even all the way down on the lateral side of the body. But most importantly, you're going to find some sensitive areas as you get closer to the shoulder joint, but just below that collarbone. So you want to focus on that area, and you might have a specific area that's more tender than other areas. And I would say it's okay to spend about 30 seconds of just kind of applying that pressure in that area. But really, you're just searching around to find those hot spots. Okay, so that first muscle group is the front of the chest. And you can even access underneath that muscle belly by simply, let me turn this down a bit, by simply going underneath here. So notice my arms a little bit more exposed from the side, I'm able to kind of take the gun underneath and get right underneath that chest area, and that's going to be very, very sensitive. And you're just kind of working along the side. So front of the chest, and then if you can wrap this tool all the way around and kind of now I have it coming at an angle, working my way up, that's going to feel really, really good. And you know, we do have a lot of nerves, that brachial plexus that comes from our neck all the way down through that side. So if one were to just apply pressure and hold it there very hard, you might even feel your hands start to go numb. Obviously, stop what you're doing there and find a different location when you're working in that area, okay? So then we're gonna move on to the trap, the upper trap, which is along the neck here. And if you just go over the top, you're already gonna feel, you're probably gonna be hitting bone. That's gonna be probably your collarbone, or you might even be touching some of your scapula, which is your shoulder blade. But really, if you kind of go a little further back and then you apply that pressure, now you're gonna get a chance to go over the upper trap. That upper trap is located through here. You can wrap it all the way around, and I'm gonna turn to my side for you guys so you can see kind of more what's going on here. And so I'm focusing on really going up in here. That attachment of the muscle is gonna go closer to the front of the shoulder, which is similar to that collarbone there. So addressing any knots or stiffness in that area can really feel good for a lot of people, because this muscle tends to be very overactive for people from always being in this position here with our shoulders all rounded. So using a tool like this can help release some of that tension. And it's very, even for me right now, it feels quite amazing. And sometimes I'll just stay here for about a minute here. And then once you've addressed the top of the shoulder there, also the chest here, now we're gonna go to the last piece, which is gonna be underneath. And now we've gone over how to address the pecs, but now if you go a little further back, which is gonna be our lats, and underneath that shoulder blade, you can kind of press into that armpit area. You're gonna feel another muscle. We're kind of searching for the subscapularis. It's a deeper muscle of the rotator cuff. And a lot of these are gonna control this inward motion here. So we're just trying to get some release from that. And so I'm still, preferably if you could be supported, that'd be great. This is where it might be helpful for us to actually start to lift our arm, because now when I lift my arm, I'm gonna be exposing this shoulder area. Okay, so you're searching for this area. I'm gonna come at an angle here, and I'm gonna gently kind of find a sensitive area, and that lat muscle, the latissimus dorsi, is large muscle. So you may even be able to access it going a little further down. Some people can be more sensitive in that area. So you'll kind of spend some time working your way down, up, and just kind of going in various different directions. And what I mean by that is not just going, you know, horizontally, but maybe even try vertically to see if you can find some tight spots, maybe even diagonally. You know, we're just trying to find any area of the muscle that might be stiff, and that may vary depending on the direction of force that you're applying this piece of equipment. Okay, so this can be very helpful, once again, to kind of help recover with any stiffness, or if you're dealing with any soreness, this can really feel good. And remember, when we're using tools like this, we're not expecting these tools to heal you. We're not expecting them to repair your injury, but we're using them as tools and a supplement to really help you start to feel better and get back on track with whatever injury or condition that you're dealing with. Now, if you found this video helpful, I did make another video on how to use this specific piece of equipment on the knee, and how, if you're dealing with any knee problems, the areas that you should be focusing on for the knee. Go ahead and take a look at the video here. I'll go ahead and attach it in the description below. But in the meantime, if you found this video helpful and you want me to make more videos about how to use this specific tool on other areas of the body, please let me know. I'd be happy to make them. If you want to support my channel, you can subscribe below. And until next time, I'll see you later.